Hello, welcome back. I'm Dr. Mark, and of course the first video on this new channel had to be diabetes. It's one of the most frequent diseases, one of the leading causes of disability, blindness, neuropathy, among other things. So today we're going to make the simplest explanation we can about what is diabetes, how can we prevent it, some of the complications and some of the treatment, and as short as possible. And in future videos we are going to dive in some of these topics and review them with a lot more detail. So let's check out the information. I don't know if you knew this, but diabetes is represented as a blue circle in the WHO organization and in many scientific circles. So today we are going to transfer that blue circle into this little blue monster to remember that we have to fight against this little monster to keep it in check and keep it from ruining our lives. So the definition of diabetes, it's a hormone disease where, of course, insulin, you may have heard of it previously, is not properly functioning. It can be alone, an insulin deficiency, or more frequently, it's a battle between insulin and insulin contrarregulatory hormones that we are going to discuss further down the road. This hormone disease will cause, or one of the main manifestations is high blood glucose. And the great problem with this high blood glucose is that glucose in a normal amount is necessary for the correct functioning of our cells. It's something we need to live, basically. But when we have very high levels for a very long time, glucose can be toxic to our tissues. So this excess glucose that we didn't have previously will arrive at the cells, and it will basically start to chew them up, to destroy them. First with the proteins through a process called glycation, non-enzymatic glycation, and that will destroy parts of the cells until the cell is no longer functioning. And we will discuss it a little bit further down the road, but since this glucose is slowly destroying our cells, it will be very slowly also the appearance of symptoms and of manifestations with the patient. When the patient is feeling the consequences of diabetes, it's usually very late. He has spent years with the disease, especially in type 2 diabetes mellitus. We are going to talk more in a while. So how bad is it? How bad is it right now? There are around 422 million people with diabetes in the world, and it's a disease that it's becoming a pandemic, if it's not already a pandemic, because most of the developed countries and the developing countries have a very high rate and a very rapidly rising rate of diabetes in their population, along with other diseases that will lead the population to have diabetes, like being overweight or being obese. Diabetes also increases the risk of other very serious diseases like heart attacks, stroke, and infections. These three things usually end up killing the patient with diabetes. Diabetes can kill the patients, but it's more frequent that it leads to these other serious diseases that take the life of our patients. And it's one of the leading causes of blindness, chronic kidney disease, and non-traumatic limb amputation. It's important to remember that most of the cases of diabetes can be prevented, so all of these cases of blindness, chronic kidney disease, and non-traumatic limb amputation could be prevented. Not all, but most. And we are currently not doing such a great job preventing this disease. Let's start with Mike. So Mike really loves donuts, really loves eating. And so when Mike eats a donut, of course, it goes through his gastrointestinal tract all the way through to the intestine. And in the intestine is in charge, the small intestine, to absorb all of the nutrients. Of course, if there's proteins, lipids, and all of the other things, it will absorb them. But for today's class, we are going to talk specifically about glucose. And this glucose, of course, enters his bloodstream, and it has to reach all of Mike's cells to nourish them. So now all of the cells in Mike's bodies can eat this glucose and function properly. Without this glucose, of course, all of our cells would die. Glucose is one of the main energy sources that all of our cells use. So once again, glucose, it's not the enemy, it's necessary for survival, and it's necessary for the well-being and well-functioning of our cells. So our cells are filled with glucose, glucose from the donuts Mike was eating a moment ago. And one very special cell, the pancreatic cell, and specifically the beta pancreatic cell, it's one of the cells of our pancreas, can secrete a hormone. It can, first of all, sense the amount of glucose. So when Mike ate that donut, of course, here's the stomach. It came all the way to the small intestine, the first part of the small intestine called duodenum. And the duodenum, one of the first places that sends the glucose to is, of course, the pancreas. And the pancreas have a couple of specialized cells called the beta cells that can sense directly that glucose that we are ingesting. Also, the duodenum can release other things like incretins that we're going to speak in other videos that help the function of this beta cell. So this beta cell senses that glucose is entering the body. It says, okay, now my cells are going, or the cells on all of the body of Mike's body are going to be able to be fed, are going to work, are going to have a decent amount of energy to keep going. And so when there is enough amount of glucose and all of our cells are already being nourished, this beta pancreatic cell can secrete a hormone very important called insulin, and it will secrete insulin into the bloodstream. Insulin in the bloodstream is going to allow for all of the excess glucose that we are consuming to be stored, and this is essential to keep us with high amounts or adequate amounts of glucose when we are not eating, because we are not eating all day long, even if we try to. So we need that reservoir, we need that backup glucose in our body. So insulin will tell the main organs that can store glucose to do it. First of all, we are going to find a very important storage of glucose in our muscle cells, and it gets conveniently stored as glucose, so it doesn't need any chemical transformations or any complex chemical transformation. Insulin will also direct the liver to storage glucose as it is, as glucose, or as a molecule called glycogen. Muscle and the liver can store glucose in the form of glycogen. Once again, it's just a lot of glucose stick together. Then if we still have a surplus of glucose, we can, through the insulin, tell the body to, first of all, the liver, transform the glucose into fat and store it like fat droplets in our liver. And then if we still have a surplus of glucose, we can store, once again, glucose through fat in the fatty cells of our body. Usually muscles and liver are kind of limited storage space. However, the fat or the adipose tissue is almost limitless. So we can store all of the excess energy and glucose that we want and that we can consume in these cells. We just make cells bigger and bigger and bigger. Also, you can start to imagine that if we consume a lot of calories, specifically a lot of glucose, we are going to fill this glucose through glycogen storage deposits, and we are going to start to accumulate fat in the liver, of course leading to fatty liver disease, and we are going to start to accumulate a lot of fat in our adipose tissue, increasing a lot the amount of adipose tissue, the size of the adipose tissue we have in our body. Of course, time goes by, someone ends up with the donuts, there are no more donuts, Mike cannot eat them anymore, so of course the level of glucose starts going down. We can't let it go too low, so we start to secrete the opposite of insulin, some hormones called insulin contrarregulatory hormones. And these hormones are going to essentially do the opposite of insulin. If when we had insulin, the blood glucose went to muscles, liver, and fatty tissue or adipose tissue. Now with this ICRH, we're going to do the opposite. We're going to force adipose tissue, the liver and muscle to release that excess glucose we had previously, whether transforming it to glucose or fatty acids and all those types of energy molecules, and then they are going to be displaced to the bloodstream to ensure our brain, our heart, our muscles, our intestines all have glucose and they can continue with their function normally. So if this system works perfectly, we can, with these two counter hormones balancing, on the one side insulin and its friends like incretins that we are going to discuss in other videos, along with insulin contrarregulatory hormones like epinephrine, cortisol, resistin, cytokines, glucagon, among others, we manage to keep our glucose level in a healthy state to the rest of our cells, around 70 to 140 milligrams per deciliter of blood. Once again, this ensures that all of our needs are covered, and this balance is the crux of diabetes. Diabetes is a disease that is going to essentially alter this balance, and of course, along with the alteration of hormones, it's going to alter the glucose level in our blood. So first of all, we have the beta cells in the pancreas. They are the ones responsible, the only cells in the body that can produce insulin and release it into the bloodstream. And some patients, especially young patients, are going to have an autoimmune disease. So some of the cells of their own body, from their immune system, that they are in charge, of course, of fighting against bacteria, viruses, parasites, fungi, it's going to confuse the beta cells with a bacteria or something else, and it's going to essentially destroy these cells. So the patient, of course, since these are the only cells in the body that can produce this hormone, insulin hormone that is essential for our living, we are going to find patients that cannot synthesize insulin, and thus they have diabetes. This is called type 1 diabetes mellitus. And of course, since insulin is essential to glucose metabolism, a patient cannot survive long without insulin, so these patients need to get insulin. Also important to note, since there is an absolute lack of insulin in the body of these patients, diabetes can advance really, really quickly. So it's not like a disease we can't find on time. It's really, really aggressive. Patients usually find out they have the type 1 diabetes because they have to be hospitalized, because they have very serious complications of diabetes, like diabetic ketoacidosis or an hyperosmolar coma. Two very severe complications that come from having very, very high levels of glucose in blood that alter a lot of other systems, and also very, very low levels of insulin in the bloodstream. On the other hand, we can have a patient that eats glucose, we have a surplus glucose once, twice, 3 times, 4 times, many times. Of course, adipocytes keep growing and growing and growing, trying to store all that excess energy that the patient is consuming. And eventually this adipocyte, this fat tissue, has had it. They can't store any more energy, so they transform in like adipocytes, but that don't like any more glucose. And so these new adipocytes start secreting massive amounts of ICRH, mainly cortisol-resistant and cytokines. So essentially what they are trying to do is saying, no more. We are not going to keep listening to insulin. Insulin has brought us to a state where we have too much energy stored. We have to stop this process. And as you may imagine, when we have this hypersecretion of ICRH, this ICRH is going to essentially block insulin activity. It doesn't matter if we have insulin or not, if it's high, if it's low. Essentially, we are blocking the effects of insulin. And when we block the effects of insulin, we are going to have that these hormones essentially do this all the time. They are forcing muscles, liver, and fatty cells to release glucose and other lipids into the bloodstream because we are preventing insulin from doing its functions, that it would be to reverse all of this process. And this leads, of course, to hyperglycemia, chronic hyperglycemia. All the time the patient is going to have high levels of glucose. Chronic periodic hyperglycemia, so the patient is going to frequently get really, really high peaks of glucose in the bloodstream. And each time the patient has one of those peaks, this excess glucose is going to go with our cells and start hurting them. One at a time and one after the other, until a lot of our cells are going to be really, really messed up because of these peaks of glucose the patient is having on the daily basis. And as you can also, this second type is called type 2 diabetes mellitus. And in this type, it's the most frequent type of diabetes. We are going to essentially have everything very, very high. We are going to have high levels of glucose. The high levels of glucose will lead to high levels of insulin. And also because of our adipose tissue, we are going to have high levels of ICRH. Adipose tissue is not the only tissue that produces ICRH. There are other hormones that also produce it, but to simplify our understanding of type 2 diabetes, we are going to leave it that it is the adipose tissue. And so we're going to focus in high glucose because from all the mechanisms that hurt our body, high glucose is definitely the most important that will cause the complications in patients with diabetes. So the glucose molecule, when it's in this peak of concentration in our bloodstream, we already said it's going to hurt our cells. Which are the cells that are going to be hurt? We are going to hurt our blood vessels, small blood vessels like the one we have in the eye, or big blood vessels like the ones we have in our heart, in our kidney, in our brains. Of course, this leads to, when the blood vessel dysfunctions, we can have damage to that structure and, for example, have blindness because of diabetic retinopathy or some other eye complication of diabetes. And we can also have stroke, heart attacks, and all those other complications we were mentioning before. We are going to affect our immune system because the immune system basically works with a lot of proteins and cells. So these peaks in glucose concentration can basically wreak havoc on all of our cells and immune cell components. This leads to high rates of infections, for example, pneumonia. We can have infections in our food, in diabetic food. We can have a high frequency of urinary tract infections. Any infection that a person can have, a patient with high glucose level can have it more frequently, and so a patient that is not properly controlled is in a high risk of a lot of infectious diseases. And finally, our nerves are also very sensitive to high glucose levels, and they essentially, we can have neuropathy. Patients frequently develop this complication, and this leads to things like weakness, like strange sensations in hands and feet, and of course pain, very intense pain that some patients might have, called diabetic neuropathic pain. So what does the patient feel when they have diabetes? The first years of the disease, unless it's type 1 diabetes, then it's like weeks to a month maybe, the patient is asymptomatic. On this time, our cells are being harmed by the high levels of glucose in those peaks, especially after eating at the beginning of the disease. But we don't have so much damage, but we don't have enough damage yet to prevent our organs from doing their functions, and then we don't feel anything. As the disease progresses, then we start to feel more and more things. We can start like having blurred vision, we can have with a lot of thirst, a lot of hunger, that's called polydipsia and polyphagia or polyphagy. We can, in higher levels, especially in type 1 diabetes, we can start with lethargy and stupor, a patient that is falling into a coma. We can have weight loss. This is a very bad sign of diabetes. It means that it's progressing really fast. We can have alterations in our respiratory rate, called the Kussmaul breathing. We are not going to get into it. We can have nausea, vomiting, abdominal pain. We can pee a lot, like in polyuria, glycosuria. That means we are essentially peeing glucose, peeing sugar. And we can have a lot more complications. As we were mentioning before, we can lose our capacity to see, we can lose our kidney function, we can lose a limb, we can have neuropathy. There are a lot of manifestations, and in future videos we are going to deep dive into them. How do we detect it? Essentially, we need two sets of tests. First of all, the tests meant to diagnose diabetes. And they basically measure the level of glucose in the blood in different circumstances. And we can also use a biomarker called glycated hemoglobin, or HbA1c, that tells us the level of glucose in the past 120 days. We are going to talk about these studies later on in other videos. And of course, we also need to test for complications. We already talked about the damage we're doing to our organs when we have these peaks of glucose. So we need to have eye exams, kidney functions, a fit checkup, among others. So how can we prevent it? I'm going to focus on preventing type 2 diabetes mellitus because it's the one we can easily prevent. Type 1, there are a lot of efforts, a lot of drugs that are trying to be developed, but it's even very difficult to detect it. Once the patient reaches the hospital, usually the beta cells in their bodies are almost gone because the immune system is doing a massive amount of damage. So it's difficult to prevent. Usually we have to treat those patients. But in type 2 diabetes mellitus, we can, first of all, since the main mechanism leading to the development of this disease is an excess of energy intake of calories, then number one, we need a healthy diet. And of course, the healthiest diet for each one of us, it's different and we need to talk with an expert. But we can, like general recommendations, no ultra-processed food, no added sugars in the things we consume, enough fruits and vegetables, and there we have to prefer fruits and mainly vegetables that have plenty of fiber and water. Drink a lot of water. Do not drink other types of beverages that have added sugars, like juices, like soda and all of those things. Check your portions because you can have very healthy food, but if you eat too much of it, then you are also consuming a lot of calories and an excess of energy intake. In fact, the CDC gives us this plate where we can kind of see how should our plates be structured. We need half of the plate with non-starchy vegetables, a quarter of the plate with carb foods, and these carbs have to be not processed, not refined, and all those things, and 1/4 protein foods. The best protein food in general is fish, then poultry, and finally red meat. And of course, water should always be our main beverage. We also need exercise, of course, as we were talking before. The muscle has a great capacity to spend, of course, glucose, energy, because it does a lot of work when we are moving, but also to store that glucose. So this is so important to ensure a proper glucose metabolism. We need at least 150 minutes per week of exercise. If we can do more, of course, it's great, but at least 150 minutes, it's the current recommendation. And we have to try to keep a healthy weight, measured mainly through the abdominal circumference, because this is very important. Although the fatty tissue, the adipose tissue in general, can cause or can secrete all of these hormones that fight against insulin, it's the adipose tissue that covers our organs, our internal organs. So the one that it's surrounding my liver, my stomach, my intestines, that's the worst abdominal tissue we can have. So we can measure it with abdominal circumference. Men should have less than 94 centimeters or 37 inches, and women should have less than 88 centimeters or 35 inches. And what if you are already a patient diagnosed with diabetes? Then there are other recommendations that we can have to ensure we have a good quality of life, because currently with current treatments, with the revisions and the tests doctors can ask, the quality of life of a patient with diabetes, it's really, really great. So we have to visit your doctor at least one per semester, per 6 months. Take all your meds as prescribed, keep a healthy weight, we already talked about that. Check other risk factors, because sometimes managing diabetes, we forget all of the other things that can affect our health and lead to heart attacks and strokes, such as lipids, blood pressure. Of course, try to avoid as much as possible smoking, drinking alcohol. Check your glucose levels as indicated. It doesn't have to be daily or weekly. Your physician will tell you what's the right amount for you. And check your feet daily, because feet are really, really a source of trouble for these patients. They can very quickly develop infections that are potentially very dangerous. Of course, in a disease known today as a diabetic foot. And of course, we are going to explore it a little bit further down the line. And basically, those are the recommendations for today's video. These are the references where I got most of the information for this video, so you can check them out and learn a lot more. And don't let this little blue monster affect our lives. We have to attack it with all the tools we have on hand, and with those tools we can tame it and have a very good quality of life. Well, that's it for today's video. I hope you liked it. I hope you find it useful for prevention, to understand the disease, to better take care of ourselves, and as always, help us change the world, share the information.